CEO board briefing for Tuesday, September 29th to order. Let the record reflect we have all three commissioners present. And our first guest for the morning is Amelia Clark on behalf of the Health District. So Amelia, welcome.
Thank you, Commissioner French. Here to talk today about the Board of Health, not the Board of Health, the Spokane Regional Health District budget for 2021. That was a big topic last week at the Board of Health meeting. And I've prepared the first draft of the budget that went to the Board of Health. And the one area that we have yet to add into the revenue for the budget is understanding what the level of revenue the health district will receive from Spokane County will be. And I have met, I think, with all of you now, and as well as Gary Petrovich, the Chief Budget Officer for the county. Oh, Gary's in there. You know, to kind of walk through the mandated services and where we see that deficit. So I'm coming to the commissioners today to find out what that allotment will be this year, so that I can prepare a second draft budget to take to the Board of Health in October.
Okay. So Mr. Cooney or Kearns, any comments, observations, discussion you'd like to have? Don't see anybody jumping off here. Okay, Commissioner Cooney.
Yeah, I think, you know, even though we haven't figured out our budget yet, you know, with Gary, that we haven't seen what the numbers are going to be. I think at this point in time, I mean, as we prioritize and look at things, the health district has to be one of the priorities. And so I'm at least willing to keep it where it's at. I don't want to cut it any further. But I don't know that we can add to it at this point in time because we don't know what that budget number is. So that's where I stand.
Okay. Commissioner Kearns?
Yeah, I'm with Commissioner Cooney on this one. You know, we'll do our best to hold you steady, but you know, at this point, before we see any numbers, I don't think we can commit to an increase. So. Yeah.
So, and I would agree with my fellow commissioners based on the knowledge that we have today. I think that's the best we can do. You know, things might change, but they can also get worse before they get better. So, you know, I have no problem committing to stay the course, but additional revenue would be a real reach, I think, especially until we know more about what our projections are and what some of the other impacts are going to be on the county. So is that a fair assessment, Gary?
Very good assessment. I'm in the process of rolling up all of the general fund departments for tabulating, making sure that mechanically everything is working well, and then coming up with also projections for the 2021 general fund revenues. And of course, that's difficult in this time because we just don't know how long we're going to be under these lockdown regulations.
Mm-hmm.
So if the county was to stay at the same level it was last year, the gap for you is what, about another 1.7 million? I'm going from memory here.
Yeah, it's 1.9.
1.9.
It'll be 1.9. And one of the questions I had last year, it was an even 2 million. And in the conversation with Gary, we talked about there'd been a shortfall for the past 10 years related to the TB program, the tuberculosis program. And so we had talked about potentially having some additional, maybe looking at $2,090,000, because the $90,000 would be the difference. And, you know, that's something that I have learned. I don't think in the past the administrator had come back to the health district or to the Board of County Commissioners when there had been a shortfall in the TB program, and that's something that they Yeah, so we really should have been coming back to the county for that because we've had to take reserve funds to pay for that. So that would be the one, just small increment that I would ask for so we can keep that moving.
And Emily, I think that's a mandatory service. RCW requires us to pay for that.
Yeah.
Correct. So yes, I think when I talked to Gary, I was okay with the extra 90,000 because I think we need to fund it just like we have to do with our other unfunded things that come to us. So that I'm in favor of making the TV program whole because that's required of us.
Can I ask a question? And I don't know who would know this, and I neglected to reach out to see if anybody knew this last week. But with the TB allocation that comes from the county, and I don't know if Gary would know this, but is the county required to cover the cost of that program, or are we required to cover a dollar amount that's determined by a formula, like based on population or something?
No,
You know?
yeah, no, I actually sent that RCW over. It just says in the amounts, I can pull it back up here. It doesn't give an amount. It just says that, sorry, pull my email, that it's a required program that you have to have. It doesn't say like by a per capita amount or a set number.
Okay.
And so the 290, that was us looking at what it cost over like that 10-year period. So that wasn't just like a number I came up with. I went back through the cost of the program, and it averaged out to 290. And I think the commissioners had given 200 for it in the past.
Yeah.
That's
Yeah,
how.
no, I think if I remember correctly, our allocation kind of bounced around that $200,000. Sometimes I think it was right at 200. I think others it was like 298 or 296, because it always did bounce around that 200. And because it wasn't always the same, that's why I thought maybe it coincided with population and somehow, and that's why we saw those gradual increases that did kind of correlate with population increases. So I wasn't sure if that's what it was based on, or if it's supposed to be that we're covering the actual cost of the program. And
Yeah.
I don't, and yeah, if
So,
the RCW, I guess, doesn't necessarily spell out how
yeah,
it's supposed to be done.
it just says that so 70.30.055 just says the legislative authority of each county shall budget annually a sum to provide such services in the county. It doesn't give a specific.
Okay.
Yeah.
So just for discussion purposes, not for campaigning either way, but our allocation last year I think was 2 million, 1.8 for the health district and 200 for TB. So you could keep the 2 million as the allocation and just split it differently amongst the 2 million. So you got 290,000 going to TB and 1,710,000 going to the health district, or you increase the allocation from 2 million to 2,090,000. So just for the sake of which way you are leaning, so you got clear direction as far as Gary's concerned. Are we talking about taking it from 2 million to 290, or doing an adjustment in the 2 million to between the TB and the health district funding?
I mean, I would think.
I was asking my fellow commissioners.
Okay.
Yeah.
I think I stated that I was okay with going to the 290. That's where we should be. So
Right.
doing the 1.8 million as the base for the general health district, and then the 290,000 for the TB program.
Okay. Josh?
You know, I would say we need to make an attempt to provide the additional 90,000. You know, again, it's difficult to until we see our numbers to know exactly where we're at. But no, that's I would support us with that being our goal in mind, is to provide the additional 90,000 and do everything we can to get there.
Okay, very good. I think that's where we're at as of September 29th at 10:00 or 10:12. Subject to change.
How we budget that?
Yeah.
5 a day.
Yeah.
Well, and totally understood on our part, you know, that it still has to go through your process as well. I think it's one of the things Gary and I discussed that I'll work with him on through this year is, you know, we're on a little bit of a different cycle in terms of the Board of Health looking at things earlier to have that two-touch process. And you know, how can Gary and I kind of work together to, you know, figure this out, I think, earlier so that we're not, you know, down to this time crunch. So I think Gary and I can work on that through 2021.
And correct me if I'm wrong, I think in the past, we've been able to look at it sooner. This year, just with Questica coming online, that we're a little behind with getting everything into the budget because we're late in our process of the budget. Normally, we've already looked at the budget and had initial, you know, conversations. So Gary, correct me if I'm wrong.
No, Mary, we are behind schedule-wise from your norm, and you know, we're working really hard to get up to speed and to get you the tabulation that you need to start the budget conversations, and we hope to have that ready for you October 13th.
Right, and it's just the fact that, you know, with Questica being new, it's a new process this year. So I'm not trying to say it's anything that you guys are doing wrong. It's just this is a unique year in the process that, you know, we would like to be further ahead of where we're at. We're not there with the new system, and understandably, and so next year we will be there.
Okay.
All right, well, thank you. I appreciate your ongoing support. I know we're still, you know, working on our COVID response as well, which the commissioners have been very supportive of. So thank you. Appreciate the ongoing support, and I will continue to work with Gary.
So you provided us with some projections a couple months ago with regard to what you thought all in for the year was going to look like for the health district on COVID. Are you still comfortable with those numbers, or do we need to be adjusting those numbers?
I'm still comfortable with those numbers, Commissioner French, because we did receive some state dollars that came to us they came to us from the, you know, they're from the feds, but they came through the state. And so we actually had to also spend those by the end of December 30th, 2020, just like you have to with the CARES dollars. So in addition to what the commissioners have given us, we also received 1.5 million via the state. So right now we're actually doing really well in terms of the response budget. As I indicated to the Board of Health on Thursday, my bigger concern, and I'm sure it's a concern for all of you as well, is what happens after December 30th. Because we know right now that we're only getting about 2.8 million via the state and federal funds. And, you know, that's going to be huge, you know, because that's barely all of our staffing. It will have an impact on isolation and quarantine and all of those things. So we're just really kind of waiting to see what happens if there's going to be additional CARES funding past December 30th. To me, that's the bigger area that I'm worried about.
Okay. Very good. Anything else for Amelia? Okay. Thank you very much.
Thank you.
Take care. All right. So next item is Chad Coles. And this is pending a potential litigation. and scheduled for,
outside counsel, like that's when she's available. I can double
Oh,
check.
Heather, the attorney. So
Heather
they'll get
Yakeley.
together.
okay?
Yeah.
So, and then I've got another executive session item. So,
10:18.
what's that?
Would your other item take?
It's probably going to take more than 13
Yeah,
minutes.
I thought.
Yeah, so probably take at least 20 minutes. Any other miscellaneous items you want to talk about? Want to talk about the weather? Yes.
Josh, you had a question yesterday of when we were talking with the Gonzaga and the Whitworth folks. I forwarded you an email and I can forward it to the other two commissioners. You had about the respirators.
Oh, yeah. Yeah.
And I got a response back, and John sent a picture of it. He was talking about the full face respirators.
That looks like that's like a hazmat mask.
Well, and he said, and he apologized for not having it right on the tip of his tongue, but he said that those items were purchased to be used primarily by their plant services and custodians when they're required to enter certain areas. So
Interesting.
Yeah, so I'm going to guess if they have to go in for like an isolation unit or something, they probably want the full meal deal on while they're doing that. So anyway, he sent a picture along with it also. He just wanted to make sure that he clarified it.
Yeah, that looks like a legit gas mask.
It does, doesn't it?
Wow.
Okay. So we can talk a little bit about this if you want. I think all of us were a little, well, let me rephrase. I know I was a little stressed by the request from the Valley Fire District on the equipment that they were looking for CARES funding to fund. Those items, they have those as part of their replacement in the normal budget, or they include them as part of their bond funding when they go out to the voters and stuff. And so I'm really challenged in terms of why we would be supplanting equipment that they would otherwise already be getting as part of their normal budgeting operation. And this is really, I mean, I'm having difficulty understanding the difference between this and a fire hose or a ladder, which are all part of their standard basic response equipment when they go out and stuff. So it's a lot like, putting a gurney inside an ambulance. They all take a gurney inside the ambulance. Why are we making the leap to use COVID funding to do that with? And it's a big ask. I mean, it could be $8 to $10 million ask if we end up covering all the fire districts under this approach. So it was a little difficult to have that conversation with David yesterday, but if either one of you want to weigh in on this now, certainly be interested in the conversation, or we can just wait until next Monday and have it when he's back. So, but I just share with you that was my response. So, Mary?
I think that's why I kept pressing as to what do all the other districts, what would their needs be and all of that. I don't have a problem funding part of it, because I think, going into the elder care situations, to have the less people, the better, and they're the ones that are more at risk. So I can see, maybe some of it, but not all of it, just because I don't want to feel like we're going to fund everybody's full budget for all these, items that, do have a COVID, relationship, because of the less, firemen that we have to have around. I mean, I just know when we've called the paramedics for my mom, it's like you get 9 of them showing up, at once, and so the less that you can have, the better, and the more they can be, distance from the patient and save a life, then I'm for that. And I think, we're seeing our highest death rates among the elderly, and our biggest outbreaks are in those long-term care facilities. So those are the more risks that they enter into. And so if we could keep those numbers down, I'd be happy with that. But I don't think it's all the equipment. I mean, I don't think all that equipment is what's needed, or, maybe we fund part of it, but or I have a hard time funding all of it. It seems like a big wish list. And I have a problem with that. I don't have a problem with some of it because I think it is, COVID related and could be, a way to help them, and help our citizens, as they go into those facilities, because it's definitely more of a risk for everyone in that case. So I don't know, but that's why, but it's like, if we fund one, we're going to fund all. And so it's like, how do you say you're willing to take care of a couple of pieces of equipment for a couple of trucks, but not all of them?
Yeah, and I mean, if it was providing the equipment for the first responders to protect them, like the PPEs and all that kind of stuff, that's a much more specific response to COVID. And, obviously we want to make sure that they're protected and stuff like that. That's an easier reach for me than the ALS equipment and stuff. So, and a lot of, all government buildings are required to have it. All retirement communities are required to have it. Where they would be responding to, they already got that equipment. So why are we putting it on those?
Yeah, I will tell you, Spokane County does not have those machines.
We're supposed to.
So when I was in elections, we were trying to get one, and we were told no. So, and like I said, my concern is, we've got a lot of elderly
Same thing.
people over in elections during election time that are under stress because they're working hard and all of that, and they're not normally working. That I've been very concerned about it, but there is not a ADE machine. I think is that what they're called?
I thought,
Yeah.
I remember us,
Same thing.
Yeah.
I remember us taking a vote to purchase a bunch of those. I thought, like, my first year as a commissioner, we bought a bunch of those
Yeah.
to put them around the campus.
See if we have defibrillators.
I don't remember how many we bought, but I remember us taking a vote to purchase a bunch of them and have them put in the building. Maybe one didn't end up in elections, but I remember us taking a vote to buy a bunch of them.
Yeah, I remember that too. That's why I made the statement that, so we'll check into it.
Okay.
John's going to track it down and find out, and maybe we'll end up, if we've got them, maybe we just need to provide a map to where they're at,
Or reallocate them
or
somewhere.
reallocate them so that we've got them in high demand areas kind of deal. So, but we'll follow up on that, Mary.
Okay.
Back with
Yeah.
this afternoon.
And so back to that though, that I think, there's some machines, some of those life-saving machines that he was talking about that I could see, again, would reduce their interaction with the person, that, again, I could see as COVID related, but I just can't see buying them for every truck. We may help buy a couple, but I wouldn't be, in favor of the entire purchase.
Okay. Jerry?
Yeah, I've got probably an ignorant question to ask. I want to make sure we're talking about the same thing. There's a defibrillator, and then there's the device that the fire districts are talking about.
Right, no, they're separate. So
Okay.
defibrillators are just the little machines that we have in, hooked up in a room on the wall.
So that's what we might be
They
talking
have
about.
on the truck. Because when I did my ride along with Fire 8, it's a whole machine that can do all the,
Just a stat monitoring machine you hook up, and it collects all the critical data and transmits it to the hospital.
What's the acronym for that thing?
I think that's the life-saving machine. I think that,
It's ALS, Advanced Life Support System.
We may not have those, but we'll check.
well, no, we don't. But I don't even think we have the ADEs, the defibrillators.
We do have those. We'll find it out.
We'll track it down.
All right.
Okay.
Thank you.
All right, so I see we have Heather joining us. Welcome.
Jessica.
And then Chad, who else is going to be joining us? Jessica?
Jessica Pelgrim and Heather Yeagley.
Okay.
That's all I was bringing to the party.
All right, so everybody that's part of your group is here. So we're going to go into executive session for two topics. One is pending, Both topics will be dealing with pending or potential litigation. The first one will include Mr. Coles, Ms. Heather Yapley, and Jessica Pilgrim, and our senior management staff. And then the second executive session will just include senior management staff and the commissioners. So the first item will take approximately 45 minutes. Is that an accurate assessment of time? Everybody's saying yes, okay. And then the next item after that will probably be a 20-minute conversation. So it is now 10:28. We'll be in executive session until, what, 11:38? All right. Thank you very much. Go ahead and shut her down.